So the exercise that I have is TKEs, which are total knee extensions, um, primarily for the knee and thigh. The indication is it can kind of help with increasing range of motion. If you don't have that final extension, it can kind of help with that. But the main focus is in the phase of strength. It primarily helps with the VMO to strengthen that muscle particularly. The exercise prescription is 3 by 12. The reason for that is that it's an in between of the hypertrophy and in the endurance, as the VMO is a muscle that's used often to get the last bit of knee extension, but it's not strengthened often. So we want it to last long, but we also do want it to be strong. Progression of this exercise is you can either use currently in this video, as you can see, we're using a green band. And what they're doing is they're driving their knee back, so the green band is pulling their knee in. So there's a strong enough resistance that um, it's wanting an anterior direction, and so they're forcing their VMO to contract to fully extend their knee back. You can progress this by again doing more. If you're wanting to focus more endurance wise, that you've kind of gotten more strength, you can do 3 by 20, but you can also just keep the 3 by 12 and do a higher resistance band. And so you can do like black or red is sometimes harder for people. A regression would be doing like 2 by 12 or again just a lower resistance band with 3 by 12 because that would make it would make it easier to go. You want to discontinue this exercise if you have like a ligamentous injury that you do not have the proper support to allow the anterior translation. But you also want to discontinue or progress this exercise if you're moving to like more of a power phase. This is a very stationary strengthening tool. And so if you're wanting to focus more on power and those kind of functionality, then you want to there's only so much resistance band you can do to still strengthen it. And so if you want to move to the power phase, you want to discontinue this exercise. But again, typically this exercise is used to strengthen the VMO as that a lot is the muscle that helps allow for the last bit of extension in the knee. And so it's an often used one for strength.